if you've decided to watch this webcast or tape, you have made a decision to consider Integrity Home Healthcare for your employment. And so we'd like to say welcome.
Dee and Sherry, what made you decide to leave
corporate America?
Yes. Can
what
I
made
say
us
that?
decide to leave corporate America? Sherry and I have both been practicing for over 15 years in our respective fields. Me, physical therapy. Sherry has been an athletic trainer and went back and got her physical therapy assistant degree. And we had run departments, run freestanding clinics, been part of the corporate wheel, if you will, for our entire professional careers. And something clicked, didn't it? Or something glitched.
We actually thought that the thing that had been lost in corporate America was the employee and the patient that we were serving. We were being asked every day to serve more patients and not get any more benefits, and actually asked to take pay cuts after the Balanced Budget Act of 1999.
What were some of your founding concepts to make it?
That's an interesting
works?
question.
Most of them came from how we were treated or not treated. We felt like with the practitioner who gives care to the patient doesn't receive the care that they need or deserve in return from the employer or from the support group that's in the office. And Dee and I, having been in multiple situations in our career, had multiple opportunities to see lacking in that area as far as how the employee was treated. And we were also always told, well, we can't afford to take care of the patient. So most of our founding principles were based on two things. Number one, take care of the patient. Number two, God, we hope we get paid for it, and we're going to do everything we can to get paid for it. Number three, if we don't, we do it anyway. And number four, we document it. We make sure that everything we've done hits a piece of paper. But in that, with those four core values, we also thought the employee deserved exactly the same thing. Take care of the employee, pay the employee. If they didn't do the work exactly how you wanted them to do it, as long as they took care of the patient, pay them anyway. So that's kind of how we went with that.
Talking to some of your employees here, that we've understood that you're kind of like the Harvard of home health care, where those standards are high. Can you share why your standards are high here and what the reason is?
We expect and we take nothing less than personal responsibility. The name integrity does not mean perfect. It means responsible, honest, accountable. It does not mean perfect. Everyone makes mistakes, but as long as it's a mistake of effort versus a mental mistake of just not caring, then you'll make it here. And that goes for anybody from the clerk who puts in the notes, puts in the payroll, to the person who's the most active clinician in the field. It's just never accepted to be less than that.
Clinical standards are something that's real important to me. I do some national speaking on that. I've written articles. I've published on those things. There's too many good standardized measures in the sciences of physical, occupational, speech, language pathology, and nursing that allow us to not have to go with our gut reaction. And every patient, when we document to these levels, we demonstrate a standardization in how we view the patients through their evaluation and their treatment course. But we individualize it to the point where no two people exactly look the same, because no two people are, with the same home setting, with the same caregiving opportunities or limitations, with the same motivation for recovery, with the same hobbies, with the same previous level of function. So when we look at levels of expertise, Sherry and I are both ex-athletes. I emphasize the ex. Our idea is that we set the bar really high. And it has been my experience that if you expect very little of people, that's exactly what you're going to get. But if you raise the bar, I think sometimes if you believe in people, sometimes it energizes them to realize that they can set their sights and do anything that they want to accomplish. What we try to do is just give them the 6'2" bar and the pole vault bar and say, let's go, let's teach you the technique, let's run and jump, and over time, with good effort and good intention, you will clear that bar. And we spend a good 90 days when we first hire people, or people choose to come and work on our team, to make sure that they not just understand the clinical expectations of excellence, but they also understand that they have to be an accountable and responsible member of this team, and that they have 90 days to kind of learn what we're about, because we are not really a corporate culture.
And we don't test people in that. In those 90 days, opportunities arise that show what they're made of. And that when we say that what they're made of, it's personal integrity. It's the ability to take criticism. It's the ability to know yourself and self-criticize. It's the ability to ask for help when you need it. It's the ability to say, I don't know, and be okay with it and find out.
It's the ability to go outside yourself because it's the right thing to do.
Where do you see yourself in the future?
Well, hopefully here. It's been 5 years, and we have a great group of leaders that have self-identified as well as been identified by sharing us as those people that just automatically can pick up that torch and carry it. The torch of the integrity vision, the integrity culture, the integrity mission, and be a guiding mentor for people and a role model. And it brings everybody along. It raises people up when you have those kind of peers amongst you. So from here, where would we like to be? We'd like to make a bigger splash in the pond, you know, not as small a ripple effect. We'd like to raise the bar for healthcare beyond the Marion County area of Central Florida. We would like to expand into other avenues to say, hey, this status quo doesn't have to be the status quo. You can do the right thing for the right reason and make a good paycheck and take good care of people.
You sound very charitable. How do you do that for your employees, or is there anything that you do special for the employees or community?
We expect a lot of our employees, and because we expect a lot, we are extremely generous, not only with salaries, which we always rank in the top 75 percentile in every salary category in the annual surveys that come out each year, but we also have a series of benefits that go beyond 401ks and health care and things of that nature. We have car washes.
Interesting story how that happens. The car wash. We provide car washes. Nobody likes somebody to come take care of their wound in a sterile environment and have a dirty car.
I think that Alex would prefer we call it car detailing.
Car detailing. And we provide that twice a month on rotation so that, because, you know, being a home care clinician, the last thing you do besides live in your car is clean out your car or make sure your car is clean. And being in the Central Florida area where some of the roads are unpaved and we really have inclement weather, especially during hurricane season, it's not always the most attractive thing to have the mud splashed vehicle coming down the road to say, hi, I'm your nurse or your therapist and we're going to take care of that infected wound that you have, and it just doesn't give off the right impression to the patient. More importantly, it doesn't really give off the right impression to the people that we work with if we don't say it's important. It's how you present yourself. You know, I know that first impressions matter and they don't count for everything, but it's real important if you value somebody and you want them to respond a certain way and carry themselves a certain way and present themselves a certain way, that you assist in any way possible. So hence the car detailing.
What can I expect if I was a new employee? What would orientation detail?
Orientation is one of the most challenging things that an employee goes through.
HR is one of the most challenging things for people that are starting to work at a place and learning the system of and the culture and philosophy of that place, as well as for the people bringing them on, trying to make them part of the team and find the right seat on the bus for them.
It can be as simple as knowing where to park. It can be as simple as knowing which bathroom to use. It can be simple as where do I put my timesheet, where can I put my handbag, anything. So we came up with a system at Integrity that
Sherry
really
came up with a system
that really brings a person in and brings them not only in to be employed, but also in to be a part of the larger group. We call it the Ambassador Program. Everyone that's brought on into employment at Integrity, is offered a person who is their mentor throughout their 90 days and their ambassador into the culture. And what they do is that mentor is there to answer every question they have, from the smallest to the most important question, and to give them someone to go to when they feel like they're getting lost. And if you are the face of Integrity, please call 352-291-6611 and ask about employment opportunities. Because if you're the face of Integrity, you need to come work here.